My case study presentation is on lung cancer. There's three main types of lung cancer. We have the non-small cell lung cancer. This one's the most common. Around 85% of all lung cancer patients have this type of cancer. The next one is small cell lung cancer. This one's also called oat cell lung cancer. And this one's the next most common, about 10 to 15% of lung cancers. This type spreads very quickly. The third type is lung carcinoid tumors, and this is the least common, with around less than 5% of all lung cancers. These type of tumors grow very slowly and they rarely spread. Some lung cancer statistics that we have here. Lung cancer is the most common cancer, coming second to prostate cancer for men and then breast cancer for women. The American Cancer Society estimates that there will be 224,390 new cases of lung cancer and then 158,080 deaths from lung cancer just in 2016. About 1 in 14 men and 1 in 17 women will be diagnosed with lung cancer in their lifetime. These risks are higher when the people use tobacco. Some risk factors that we have for lung cancer is obviously tobacco smoking. It can be first-hand or second-hand smoke. Exposure to radon, and this is just a radioactive gas that comes from the breakdown of soil and rocks. We have the exposure to asbestos, and this is most commonly is found in mold. Then we have air pollution and family history of lung cancer. In the top right of the page, you see that we have a healthy person's lungs, a non-smoker, and then we have a smoker's lungs. Look at that. That is disgusting. That's from all the tar that is in the smoke, in the tobacco. Some signs and symptoms that we have. A cough that just doesn't go away or gets worse. Chest pain that gets worse when you deep breathe or when you cough or even just laughing. We have shortness of breath, feeling tired or weak. And then when we have infections develop that are like bronchitis and pneumonia that just don't go away or they keep getting worse. Another one that I have not written on here is spitting up blood, coughing and spitting up blood. Diagnosis of lung cancer. Usually the symptoms don't arise until the disease has already spread and is advanced to a non-curable stage. Then most of the lung cancers are found by accident, actually, when they're testing for other medical conditions, such as like bronchitis or pneumonia. Screening is the term used for tests and exams to find a disease when people don't even have any symptoms yet. The most common one for lung cancer is the low-dose CT scan. And that is the one where they have you lie down and they have like a circular tube around you and they just slide you through it does make a lot of noise, but hopefully most of the time it doesn't take too long. Treatment of lung cancer, it's mainly dependent on the size and the stage of the cancer, but there are different ways that they can treat it. We have surgery, where hopefully they can get a lot of it out, but you will still most likely have to undergo radiation therapy and chemotherapy. There's some side effects to these treatments, such as fatigue, nausea, and vomiting, and then sadly we have pain. Exercise in lung cancer. The right amount of exercise can make the patient feel better during their treatments. Exercise just in general does make people feel better, so it makes sense that when somebody's undergoing this type of situation, that it can help a lot. Even low-intensity exercises, low-intensity movements, so it's just like taking a walk. It could be going out to get the mail in the mornings, or taking your dog for a walk. And then we have light stretching. This can just be like when you wake up in the morning, just stretch a little bit. These can all just be great exercises for people with lung cancer. Moderate intensity exercise during lung cancer can improve a lot. It can improve your fatigue, lessen depression, stress, anxiety. Then it can improve your self-esteem. And then obviously we're going to have improved cardiovascular fitness and muscular strength. And then it can also just improve your breathing in general. Case study that we have, the patient's name is William. He was first diagnosed with cancer at the base of his tongue, and that spread to his lymph node, and then eventually it spread down to his right lung in the lower lobe. He was diagnosed with lung cancer at the age of 77. William uses Symbicort inhaler, and this is for his COPD. Then we have Cardizem for his high blood pressure, and Lipitor for his high cholesterol. And then William was never diagnosed with type 2 diabetes. However, his doctor did still prescribe him metformin, but this was because he was in that pre-diabetes stage where his fasting glucose was still still higher than normal, and it was right on the line of being classified as in the type 2 diabetes range, but he wasn't quite there. But just to call it safe, the doctor did still prescribe him metformin. Some more details just continued here. We have William, and he's undergoing radiation and chemotherapy treatments, so he is going to be very tired. Risk stratification here that we have. If it is a risk, it says yes in the bold red, and if it's not a risk, we have no. For age, he's obviously older than 45 years old. He's 77, so this is definitely a risk factor. His high cholesterol, we says, even though his cholesterol normals are level, that's only because he's on medication to take care of that. So this is a risk factor. And it's the same thing for the high blood pressure. For type 2 diabetes, we still said no just because he wasn't technically diagnosed with it, even though he still has his medication that's keeping that in track for him. COPD, definitely a risk factor, even though it's still being controlled by his medication. And then lung cancer, obviously, is a risk factor. William is a high-risk patient. The goals of this exercise program are to decrease his fatigue, improve his self-esteem, improve or maintain his cardiovascular fitness, and his muscular strength. We just really want to improve his overall quality of life. Max testing is not recommended for William, but submaximal testing is okay, but only if we have that physician present. The exercise test chosen for William is the cycloergometer test, and we're going to try to stay in between that 8 to 12 minute range. The test will start with minimum resistance because we don't want to have him tired. He is undergoing his treatments, so he is going to be already tired to start with. He's 77, he's frail, so we want to make sure he can make it through this exercise protocol. So then we'll increase every 3 minutes increase the resistance every 3 minutes at the physician's discretion. The exercise prescription that we have for William, aerobic training, we want to aim to get 3 to 5 days per week. We chose RPE instead of VO2. The RPE scale that we're using is between 6 and 20, so we wanted to have William stay between the 11 and 15 on the RPE scale. The time of the exercise, we want to try to get 20 to 30 minutes per session. If you can't get the full 20 to 30 minutes continuously, it's understandable. We just want to break it up into shorter bouts then. We'll have about 2 to 3 minutes of exercise, and then we'll take like a minute or two rest so he can catch his breath, and we'll just keep going back and forth doing that until he reaches that at least the 20 minutes. The type of exercise that we have for William, we can do walking on the treadmill or outdoors. It can be just like taking the dog for a walk, going to walk in the park, and then if he has access to a gym, he can do a leg or arm ergometer. For resistance training, we're going to try to get 2 to 3 days per week. The intensity, we're going to have between the 10 to 15 repetitions. We chose the RPE scale again, and I want to do 11 to 15 on the RPE scale. We're going to try to get 2 to 3 sets per exercise with about 8 exercises total involving the major muscle groups. He can use elastic bands, free weights, and then again, if he has access to the gym, we can use weight machines. just exercise prescription continued here. We have flexibility and balance. We want to try to do this daily. We want to hold to the point of mild discomfort. We don't want to hurt him here. It's not the point of stretching and improving balance. It can be not long, just 5 to 10 minutes a day. Static stretching is one type of exercises we can do for him. And then also yoga. Yoga is great for flexibility, and it's also great for balance. When people go through chemo and radiation, and they're bed rest for a lot of the time, and they're just really exhausted, and they don't get up and move a lot, they do lose muscle, so then in turn they're going to lose their balance a little bit. So yoga can definitely help improve there. So what I want you to get out of this presentation is that the best way to cure lung cancer is for it to be caught early. Lung cancer can be avoided if you just don't smoke, or you stay away from secondhand smoke of others. And then let's say your job, it puts you in a dangerous environment that has cancer-causing agents. You could either try to find a new job. Might not be the best thing to do, or you can also just be very precautious. Undergo regular screening just to make sure you're safe and you're okay. And then last, exercise doesn't cure cancer, but it can definitely improve the overall quality of life while you're having to cope with cancer. Cancer doesn't just affect the person with the cancer, even though that's the most important. It affects the family members. It affects the spouses. So, just if you have exercise, if it improves the cancer patient's outlook, then it just helps out with everybody that around him. It helps give off a better energy. So, we want to improve the overall quality of life for the cancer patient, obviously, and then in turn that can improve the overall quality of life for the spouse or the family members. And then we have the references.